Thanks, Adam. We're here now with Dr. Michael Kuhlenschmidt from Christie Clinic, making the morning rounds this morning. Good morning.
Morning. Thanks for having me again.
Absolutely. So Adam was just talking about colder weather, and with colder weather, we often associate the flu.
Absolutely. So we're in the middle of the CDC's National Influenza Vaccination Week.
Right in the middle of it.
Right in the middle of it, December 2nd through the 8th. So basically, the CDC came up with this week because we know that flu vaccination drops off after the end of November. A lot of people think it's too late to get their flu shot.
Yeah, and I'm sure a lot of people are probably sick of hearing about the flu. We know. How are you going to convince them?
Right. Well, so the flu is not just a bad cold. The flu is a very serious illness, and there's some statistics to back this up. So in the 2017-2018 flu season last year, there were 50 million flu cases in the United States. That's the population of Texas and Florida combined, roughly. There were 1 million hospitalizations and about 80,000 deaths. So this is a very significant illness. It's more than just a bad cold.
Yeah, and 50 million people is roughly 1 in 6, 1 in 7 people.
Absolutely. Yep.
In the country. And so really the flu season is just ramping up.
It's just ramping up. And in fact, in our area, we haven't seen a lot of flu yet. So there's still a huge opportunity to get vaccinated before it starts.
Absolutely. And, you know, on top of this, a lot of people think, you know, I don't usually get a flu vaccine because I never get the flu or I don't really get sick. How do we get those people to change their mind about that?
And that's a good point, and that's fair, and that's easy. I mean, why would I get something when I don't feel ill?
Right.
But I think there's a couple important points to make there. Number one, the flu disproportionately affects and seriously affects you know, people at extremes of age, so the very older people with chronic medical conditions and young children as well. So you may get a mild case of flu, which just feels like kind of a run-of-the-mill cold, but you could transmit that to other people, and that's a really important concept, and a lot of people will grasp onto that and use that as their reason to get the flu vaccination. The other issue is that it is the single most effective way to prevent this disease, and this disease can have very serious health consequences, including death for people of any age and health condition.
Yeah, and we've also talked about the concept of herd immunity.
Right.
You know, talk about that as far as why it's important to get one, even if you don't usually have symptoms.
Yeah, certainly. So once you reach a certain threshold or amount of people vaccinated in a community, the likelihood of the disease spreading is much, much less. And so that applies to influenza. Obviously, the problem with the flu vaccine is the flu virus changes. It changes every year. Minor changes and major changes, and so we have to keep getting revaccinated.
Sure.
The other thing I was going to mention, though, is that a lot of people don't get their flu shot because they're worried about side effects.
Yeah, I was going to ask you about that, actually. The symptoms or anything that they may be feeling, is that true?
Right. So remember that we're getting flu shots in peak viral season, okay? So in the peak flu season, about maybe 15–20% of these upper respiratory illnesses are the actual flu. The rest is something else. So the odds are, and what the CDC thinks, is that when we're giving flu shots and people then get the flu, we know there's no live virus in the flu vaccine, so it cannot cause the flu. But oftentimes it's associated with other infections that happen at the same time of year. So really there's very little risk, and it's important to talk about the risks that do exist with any vaccination, but the flu vaccine has very little risk, and in most people, the benefits of vaccination far, far outweigh the risks.
Essentially. So if you experience any symptoms after you get that vaccine, you are not getting that specific flu strain that you were vaccinated for. It could have been a different strain or some other illness that you just picked up.
Obviously, if you have symptoms after vaccination, it's important to talk to your physician about that, but it's not the flu.
Very good.
So that's an important concept.
And the most important part about this week is that there is still time to get vaccinated.
Absolutely. There's still plenty of time. We're not seeing the flu season ramp up here yet, so now's the perfect time to get it done.
Okay, doctor, thank you so much.
You're very welcome. Thank you.
We'll be right back with more of The Morning Show right after this break.